And welcome back. And we're getting ready to move into our first segment in studio for today. And we're going to be talking about dental health in northern Belize in particular. And joining us for this conversation, we have Chief of Staff from the Corozal Community Hospital, Dr. Jorge Sahia. We have dental surgeon for the Northern Regional Hospital, Dr. Gustavo Castaneda. And we also have dental surgeon for the Corozal Community Hospital, Dr. Efrain Sima. Good morning, gentlemen.
Good morning.
And welcome
Good morning.
to the show.
Thank you.
Good morning, thank you.
Thank you very much.
Now, we don't get a chance very often to focus on the north and what is happening there in terms of dental health. So let's start off by just talking about the program itself that you have in the northern districts.
Yes, good morning. First of all, I would like to present Dr. Castaneda. He is the dental surgeon for the Northern Regional Hospital, Orange Walk. And Dr. Sima is the dental surgeon for Corozal Community Hospital. So we have one in each district for the north of Belize.
How long has the dental program been up and running in the northern parts of the country?
Well, it has a number of years from since the actual dental program began in the Ministry of Health. There was a little absence of a dental surgeon in Orange Walk, but fortunately we have Dr. Castaneda who has joined the team.
2 years ago.
And I was recently transferred to Corozal Community Hospital, but they had a dental surgeon working there. And we are still carrying out the same programs as per norm. And we have normally an action plan that we carry out every year.
Now, the dental program is one of the less highlighted program of the Ministry of Health. You work a lot with preventative care and a lot with education and awareness, especially with children. So let's talk about what your particular, I believe you called it action plan is in the particular districts. Let's start with Orange Walk.
Okay. First of all, we have dental care for pregnant mothers, which, well, it is a bit, how to say it? Well, it was a taboo at the beginning, right? That dental care could not be done to pregnant
women,
mothers.
that's right.
Yes. But we are trying to break that.
So it's not true. Is that what you're saying?
No, it's not true.
Okay.
You can
So pregnant women can't go to the dentist?
Yes, of course, of course.
Where did that come from? Do you know? Or what is the fear that people have behind it?
Well, it was being linked that that whenever you are injecting or doing anything to the mothers, there could be a miscarriage or something like that, right? Which is not true. There are specific measures and ways how to treat pregnant mothers, right? So that's what we're trying to break that taboo, but just by educating, by going to the talks with the MCH, with maternity, and well, we have had a lot of outcome from that, right? From a lot of women are visiting the clinic now. Yeah.
So you've been able to get some women to learn that it's
yes,
okay
a lot
for them to be pregnant and go to the dentist.
Yeah, a lot.
And that's the focal point. That's one of the focal points for your program in the Northern Regional.
No, we also treat children, mainly educational. We have every Thursday. Well, in Orange Walk, it's every Thursday that we go and have education for children from school to school. We pick a school every Thursday, and then we go there and educate them, right? And like you see that happen in Corozal. That's from Corozal. We visited Corozal. This is a very special group of children, right? Okay.
And Dr. Sima?
Basically, what the program encompasses generally, and the national action plan is basically the first that you saw at the beginning, which Dr. Castaneda mentioned was, first of all, we have a prenatal program. And it has been a challenge to break the barrier to get the pregnant woman to visit the clinic. And it has increased, and we have had a lot of support from the maternal child health care. And the nurses are really pushing the pregnant women to visit the dentist. And what we have developed now is a schedule or an appointment-based a visit to the dental clinic, so that the women can get a cleaning, can get also an assessment of what is happening in their mouth. It's very essential and important for women to know that at this stage, a lot of things can happen, especially with oral health.
Yeah.
And during this stage, women will be a little less reluctant to have the care, because a lot of changes in the diet, changes in the moods, and a lot of bad things happen in the mouth during this stage. So we want to prevent that.
So they're more prone to dental health issues.
Exactly.
During their pregnancy.
Correct.
Yeah.
So what we are pushing for is that a female who is pregnant will go through all this process during the 9 months without any problems in the mouth. So we provide a cleaning, and we also provide, when we can, fillings if it's necessary. And like Dr. Castaneda says, we are trying to break that taboo that pregnant women cannot receive any dental care. There are, of course, limitations, and we, of course, take the precautions, the necessary precautions, as to what kind of treatment we can offer. And we are getting a lot of support. We have, actually, in the northern region, we're booked with pregnant women. We're booked up to almost the mid of this year. So we are getting a lot of women coming in, getting their cleanings. Fluoride as well are applied on their teeth, so that their teeth are a lot stronger, and they do not have or suffer any bad problems during this stage.
So there is a shift taking place. Yeah.
Definitely, most definitely. We are getting a lot of support, like I said. And we have additional programs, and apart from the National Action Plan, national programs that we have implemented a couple of other programs in the northern region. Since Dr. Castaneda and I have gone through different trainings, especially when it comes to preventative dentistry for kids, which has become a priority group for our dental program. Yeah. And he's going to elaborate a little bit on some of the images and some of the treatments that is being offered at the Northern Health.
Yeah.
What we're seeing is a preparation on deciduous teeth. That's the teeth that kids have, right?
Baby teeth.
Yeah, baby teeth. So what we do is we do the preparation. We put the Cafosol. Cafosol is a solution. We mix it together. That's to stop the cavity to continue, right? And then after that, we put a special type of glass ionomer, and that has had a very, very, very good result to us, right? It's not that expensive.
So it's an alternative to filling.
It's a it
Okay.
is a filling.
Extraction
It is
for
to
baby
prevent extraction, because in the past it was only extraction that could be done, but this tends to help a lot. We place that is the glass ionomer, and then after that we just treat it with fluoride.
And why is that such an important consideration in terms of saving the baby teeth? Because a lot of people.
That's what I wanted to ask, because in terms of taboo or in terms of misconceptions, that's a primary one. That people feel the baby teeth, if they're rotting, if they're decaying, it's okay because they'll lose them anyway. Do you still find that when you're doing outreach?
Yeah, well, the people have that belief, like, overall, but what we try to do is to make them understand that the baby teeth has to be there in position to save the space, because if you lose a baby teeth, what it does, it narrows down the space, and whenever the permanent tries to come out, it has no space where to come out, so it comes out to the back, to the front, or it rotates to come out, right? So it will have problems with orthodontics in the future, right?
Now, so is this a program? How do children get into the program? Is it a situation where you're more mobile, that you go to schools, etc., and engage them there, or is it a situation where it's just preventative kind of education at the schools, and then you have them come in to your particular clinic?
Both things happened. We have this as an outpatient program where kids would come in, the parents would bring their kids, and an assessment would be done. An appointment would be given if there's the need. And we want to emphasize that the dental department is not only for taking out teeth, and that's a misconception that people will have, the idea that people will have. that we are not there only to take out teeth. It's been a challenge to educate people and sensitize people. We're getting also a lot of support from the parents now because, of course, they're understanding the importance of having saving the milk teeth. And the idea is to preserve them until it's their actual time to be lost. So every tooth will have a specific time, and that's the important thing, and that's what we want to stress out with the parents. So the parents would come in and get the assessment, and an appointment would be given. And for example, the images as you see there, that's a mobile clinic. That is done also in certain schools, whereby the dentist will go on one occasion, and a screening would be done, and then we would go back, and then we carry out what we call the preventative measures. And we want to emphasize as well that the treatment that the kids are receiving at our clinics is the latest in preventative dentistry, and of course they're getting the best material and of course the best techniques applied.
And the cost?
And the cost. It's very expensive, but we're trying to offer it as much as we can to the public.
Yeah, it's usually at a much lower cost than private care.
Well, actually, for kids, it's completely free.
Yeah.
It's completely free.
Now, one of the questions I have there, because a lot of people, we know that, you always hear you should visit the dentist twice a year, every 6 months, etc. But for a lot of people, because they've had bad experiences as adults, they also don't pass on the behavior of a positive attitude towards dentists. Right. How much of that is what you're also combating in terms of the perception? You go to the dentist when it's completely necessary for an extraction. You can't handle the pain anymore. Yeah.
Well, you see, that's another thing we need to break. It's a very big barrier because, unfortunately, when you have the bad experiences, when you go to the dentist when you're in severe pain.
Yeah.
And if you visit the dentist just for a routine or a normal checkup, then that would change the whole scenario. And we want to we want to focus on prevention. I like the ad that medical associates use, prevention is better than cure. Because when you go to
it's also cheaper.
It's also cheaper, of course, and the experience is a lot better. So going every 6 months is just like maintenance. Everything is maintenance. You maintain your vehicle, you maintain your household, whatever. And health is also important. And dental is part of the integral well-being of us. So if you go to your physician as well, your physician should also recommend that you visit the dentist for you to have an oral checkup to see what's happening. And part of that is what we are doing now in the northern region. We're also screening for any abnormal lesions in the mouth. Due to my training in oral pathology, now we are carrying out that. And we have had, unfortunately, some abnormal lesions who have ended up in very negative results. And this is something we want to emphasize on people. You need to visit the dentist not only to check on your teeth, because unfortunately, we are called dentists and we are called the dental department, but it's not only teeth. It's the oral cavity, which encompasses everything, the soft tissue, hard tissue, everything that's exactly.
Now, I wanted to ask, obviously, there is a national plan, as you mentioned before, but there also usually are particular issues that relate to the communities that you work in. If you talk about Corozal, for example, you have the town, the urban area, but there are also lots of villages as well. So transportation is usually an issue. In Orange Walk, the situation is similar as well. So are there any community-specific issues that you find need to be addressed in the northern area that isn't a part of the national plan or isn't a priority in the national plan?
Well, not really. We haven't had problems with transportation from us going from the hospital to the villages because, like you said, sometimes the villages, it is very difficult for them to come to town to get checked, right? And sometimes whenever they come, it's like around 9 and they're already like at 10, 11, the bus will leave to their village. So it's a bit of a drawback, that, right?
So you have time constraints.
Yeah, time constraints. We just try to monitor which patient reaches and to try to give them what they came for, right? As soon as we could, so that they have time to go back. Yeah.
Now, you're talking about different programs that you're running. You talk about the one for pregnant women and for children. How do you deal with the general public, people who walk in, usually, like we said, in crisis? How do you try to educate them to avoid that kind of engagement where it's completely necessary and not a good experience?
On the day they visit, unfortunately, when it's an occasion like this with chronic or severe pain, we still go ahead and make an assessment of the rest of the tissues and of the teeth. And we also give them education right there and then. And we advise them that it's very important for them to do the necessary repairs if they need to repair, or do the necessary visits so that they don't go through this experience again. And it's unfortunately that most of these experiences occur at night. And then the patient would come in and say, I didn't sleep at night. I was looking for some help, a medication, blah, 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 and the neighbor gave me this and this and that, but it didn't work. So we always emphasize, it's better for you to come even before, because unfortunately, decay is not going to repair by itself. It is not. You need to seek help. The same thing with gum disease. It is not going to repair by itself. You're not going to do anything to stop it unless you visit a dentist, and then you're placed under a treatment plan. And this is how we go about trying to sensitize patients so that they don't go through this problem again.
Now, let me bring it back to Dr. Sahia in terms of the integration of the dental services within the hospital, within the clinic itself. Is there a general checkup that is done and recommendations are made to go to do your dental checkup as well?
Yes, part of the maternal and child health program involves dental appointment during the first visit. Independently of the blood works, the ultrasound, to get the full assessment. Dental is part of the procedure to go through. Another part of the process is on stimulation month. The preschools usually take the kids to the dentist department. That serves as a sensitization process. Some of the pictures we just saw, we have the kids, they usually cry when they reach to any type of hospital or medical officer or dental. They usually want to be the first ones to sit on the bed and get their teeth checked.
So they're still eager at that age.
Yes, yes.
Well, the tooth fairy obviously helps. I saw that.
Now, one of the things that you have, and I remember was very visible at one point, was having all the children kind of line up, teaching them how to brush correctly, which directions, how long, etc. Is that a big part of what you do at that level, and how far up does it go? Is it only at the infant division stage, or do you actually go up to the middle and to the upper?
Yes, the target, the priority target group is of course primary school, and of course preschoolers. So the idea of going mobile and idea of doing the outreaches is to basically carry out this, and we have for the past 5 years now we have implemented what we call the national fluoride program. It's not extended completely nationally, but we go to the rural areas, and this is what specifically we do. And we also apply the fluoride varnish.
You apply fluoride on
yes,
the teeth.
but this is a little bit different than what it used to be back in some years when gel used to be applied. The fluoride varnish is a little more expensive. We have sponsors. Varnish. Yes, it's like actually applying caramel. Exactly, becomes sticky on your teeth, so it stays longer. And then we give instructions to the kids and parents what to do the rest of the day or the following hours. So this is, of course, the longer this product stays on the teeth, it's a lot better for the kids. And of course, we're trying to stimulate the schools. There are certain schools in the Northern District that have a brushing program. So this is very good, and we have a lot of changes. You can see a lot of changes in between schools who have the brushing program and who do not.
So what does the brushing program actually entail? After lunch or something?
Correct. It kind of varies from schools, but what they're trying to implement is actually part of their school program. In the list of school supplies, they have to bring along a toothbrush. And then they would ask for donations of toothpaste and what's that. And then when kids arrive at school in the morning, they would automatically take them out to brush, and after lunch. And kids will learn this as they go on through the years. And as soon as the bell rings, the kids will take their toothbrush, toothpaste, and they go out with their cups and they brush. So what we would do when we visit them is just to re-emphasize and go over with them the technique of brushing, and to let them know that it's very important for them to do so.
Now, as professionals in dentistry, one of the things I was reading quite recently is generally we were taught you brush immediately after eating. In some quarters, they're saying leave it for half an hour for your saliva, etc. to work. Where is the current thought on that process?
There are different investigations. And of course, some investigations recommend that you wait 15 to 20 minutes because there's a buffer system, because there's a remineralization, demineralization process taking place. And of course, if you brush right after, then you're contributing to the demineralization process. But normally what people will do is it will be best for you to brush even after, because if you forget, people will say, I don't have time to brush, even at lunch. And the recommendation is not only for you to brush on your main meals, brush anytime you have something to eat. That's my recommendation. I don't recommend brush twice a day, because if you recommend brush twice a day, probably you brush once, right? So every time you have something to eat, if you want to keep your teeth healthy, you brush after every meal.
Okay. So what is the schedule for the dental clinics at the various hospitals, so people can go and visit?
Okay, in Orange Walk from Monday, Tuesdays, and Wednesdays we have the walk-ins, people from the adults, and on Thursdays we go to the schools to visit the schools and give the proper education to the schools, and on Fridays it's for pregnant mothers. That's a program that we have.
And it's the same thing in Coral.
Just the days vary. We have Monday, Wednesdays, and Fridays for outpatient general consultation. Will be from 8 to 12, and from 1 to 5. Just to make notes, and the public to know that although we are from 8 to 12, it doesn't mean that we take every hour. Or if you come 10 to 12, we might take you, because we need to make a stop so that we can clean and have the instruments ready so that we can go for the second batch.
Yeah.
And sometimes, they won't understand this, but we need to stop, or else we won't be able to have enough instruments to go through the second batch. And then Tuesdays we have scheduled appointments for pregnant women, and Thursdays we have it for outreach or mobile clinics.
Okay. Well, gentlemen, thank you very much for joining us and talking to us about the dental health program taking place in the North.
Thank you for inviting
Thank you for having us.
All right. We're going to go ahead and take a break, and when we come back, it's to talk about the Baker to Vegas Challenge Cup Relay 2016. So stay tuned.